Thank you so much, Dr. Manoj, for taking us through um, this concept, which is building up very nicely in pharmaceutical industry, the digital concept. You backed it with the research that you carried, and it really gives us all, a warm feeling that things are going to be digital plus physical, because while there was corona, many of the professionals and companies were thinking, still corona is there, but at that time when there was no physical meetings and all, they were literally very fearful and thinking everything would be going digital. And now it is coming out as a phygital, which you very rightly pointed out. Dear participants, thank you for being there with us for the whole talk by Dr. Manoj. And now we will be taking up the question and answers. We have received a lot of them. Let me start with the first question, which was asked by Mr. Satyam Jha. He is asking, for the major brands which are widely available, telemedicine is ideally going to benefit. However, how can smaller or newer brands adapt to this challenge?
Okay, so I think the question is, you have one therapy area and you have a couple of leading brands and they are widely popular, and they are the one who would get appreciated and recognized, and they would gain more market share. But I am a small brand manager, or I have just launched my brand, and how do I make my presence? I think many a times what you are saying is true. So you need to be very, very, that is a time when your market research will work handy, that which is one specific market I really need to prioritize. Do they have a very strong presence across country? And when you do that market research, you would find that there is a lot of, demarcation in tier 2, tier 3, interiors town. There's a lot of demarcation or deficits which is there across therapy area uses. So you need to pick up your spots where you have a low-hanging fruit. And when you penetrate this, and you need not have a national level strategy, you probably could be a very simple area specific strategy to begin with and expand your forte. So that's how I would have done if I was a brand manager. I hope I have answered you.
Yeah. Thank you, Dr. Manoj. Next question was asked by Mr. Nitin Kumar Gautam. He said, patent infringement are common nowadays. Okay, it is very recent news about this thing came up. How do you feel that it will prevent the new molecules to be launched in a much needed population of our country?
Okay, so probably this is not a digital question, but I'll try answering this slightly bit in a brief. I think there's a place for research and innovation, and that must be respected. Had it not been those research and innovation, many of us probably would not have been alive. If there was no research which was done on remdesivir or tocilizumab or favipiravir, probably we would have, many of the ICU patients during COVID time would have been dead. But yes, very recently you would see that even these organizations are also reaching out to Indian organization, because Indian organization have got a key strength in upscaling and reaching out and coming up with a very turnaround time. So you see that synergy which is happening between innovation and great insights which these Indian organization is also developing. But there is a lot of role for these innovations to happen. Once that is respected, once that period is over, probably it is for wider reach and penetration. I hope I have answered you.
Yeah, thank you. Next question from Mr. Vikas Patnaik from Intas. The pandemic has greatly increased the potential of telemedicine by many folds. The use of telemedicine has been all-time high during the pandemic. And several research studies by the consulting giants revealed that the patients prefer meeting a doctor in person over a digital interaction, as the presence and touch would make them feel examined and treated. Now that the pandemic is turning to an endemic, can we expect patients going back to their earlier preference, eventually leading to decrease in the usage of telemedicine compared to current all-time high?
Mhm. Okay, interesting question from a fellow colleague. Uh, my purview is that it really takes something very big normally in our life to change a behavior, and we have seen this during pandemic that telemedicine uh, was widely acceptable. Just to give you an insight about what happened in phase wave one and wave two. Wave one, all of us were confused. The doctors community also had a lot of questions. And anybody, at least in the first 2 or 3 weeks, having COVID, irrespective of symptoms, symptomatic, asymptomatic, were admitted. In wave two, you found 65 to 70% of the people taking treatment at home with the help of telemedicine. Now, please don't forget, it is these set of people who have understood the importance of telemedicine. If they could defeat COVID, life-threatening situation, and understand it well, now they understand that what is a medical cost and what is a fringe cost. If I need a proper diagnosis, I probably would still prefer a first time physical visit. But if the diagnosis is done and I need to be on a routine therapy, I probably may not visit the doctor's community and still continue the benefit and the convenience of my home in the second visit till the sixth visit. And I still would go back to my doctors after six months or 7 months. So anything which requires active intervention, active examination, diagnosis, and initiation of a treatment probably would be physical visit. And anything which requires continuation, sustenance, minor dose adjustments probably would move into telemedicine. Please remember, India is a vast country, and the total number of doctors community, doctors to patient ratio is extremely wider. Even for us, having these telemedicine will be helpful. Plus, the cost of traveling to another city, staying there in a lodges, inconvenience, no emotional support, no food. These are a lot of things which will come and get converted into a medicine cost. Patients from dropping on the fifth dose probably would continue the dose. I hope this was a wider answer, but it will give you a perspective.
The next question is from Mr. Vivek Mishra. Very well explained by Dr. Manoj about the benefit of digitalization at the super specialist doctors level. I feel same is true not only for entire super specialty segment, but also GPs and other medical fraternity too as well. Isn't it? Moreover, I feel I have become more productive after COVID era, as somehow we could understand the benefit of digital platforms. And may I request sir to please throw some light on it?
Okay. uh, it's very interesting that even while you do research, you look into applicability of the same research into a wider segment, wider gamut. And those of us who are researchers, we understand that you can't get data points very when your sample size is very broad. So obvious it is that you'll have to choose something which is specific. So in research work, you say you don't do research work of the entire pen. Probably you do research work only about the nib of the pen, because that is something which will be in a position to get you some insights. And that's what I did. But whether this has got applicability of a wider audience. So what I had done was I had vetted the concepts to a wider audience, may not be in the same sample proportion, and I found that the applicability of the same was there. And you do this with various levels of testing. I mean, there are a lot of SPSS tools which is there. So you look into a specific area, you do it with 2000 plus doctors, but you try reaching out to general practitioners and physicians, and almost the same behavior was echoed. So this is applicable to a wider audience. I hope I've answered you, Vivek.
Right. Dr. Manoj, there are three questions which are interlinked, so I will ask them. It is all about social media used by doctors spending enough time to go through information and all. So one, Mr. Ronak Maheshwari has asked, as many of the pharma companies are sending their product details and many more information through social media, but does doctor spend enough time to go through the information? The second related question is, even if the content is good, but customer is unaware of the stuff, does it help? And the third is, what would be the social media platforms that super specialty doctors be interested in? All connected to doctors and super specialty, their time on social media.
Okay. So I think uh, I think this is going to be a common perennial marketeer problem, that you feel that your product is just wonderful and your content is just amazing, and the doctors community needs to know, and you try doing everything possible to uh, reach out that communication through some means. Maybe the method to reach is not happening. uh, Many of us as marketeer are too blank or too placid in our communication, and we feel that the messaging is not happening. But we hardly spend time in building a trust. Whom do we listen to in real life as well? We listen to people whom we trust. We listen to people whom we feel is worth it. We listen to people who feel can provide us those value additions. So those of us as marketeers, we are not able to get our communication inside a doctor's mind. He's not able to give us space. We really need to reflect. Is it about the communication which I've created, or it is much more deeper? Maybe he doesn't value that organization. Maybe he doesn't value that communication. Maybe he doesn't value the authenticity. And the same applies in our own life. Do we pick up every sales call? We do not. Do we talk to people who are worth it? We do. So a lot of time needs to be spent on creating that equity, which will enable our sales and marketing professionals to be heard. And that's my submission.
Sure. And Dr. Manoj, if we asked about these messages going to doctors and being very uniform across, does segmentation play a part here? Segmenting, yeah.
Yeah. So I did touch upon it that if I have a couple of friends altogether into a different domain. And when they uh, when it was a hospitality industry, and I asked my friend, uh, for have you done my segmentation? And it's a personal example I'm sharing. Said I was shocked and surprised that even in hospitality industry, place where you go for your corporate meetings, they have done those segmentations. For example, in my case, this is fast check-in, fast checkout, clean room, no nonsense, Wi-Fi connectivity. He will enter into meeting fast. He will leave the home hotel fast. These are his normal requirements. No use of swimming pool, no use. Maybe he will go to a gym, and that's it. And I was very surprised that how well they have detailed those things. Same is the case for every customer. When we do a profiling, our digital adaptation or our communication is going to be very, very different. We spend a lot of time on only talking about the content of our product. The messaging of the same content, even digitally, can be very, very different to four set of doctors who have got four different behaviors. Probably for paucity of time, I would not be in a position to do it in one session. But those four communications would be very different. And yes, the first thing we read, I remember you were the one who hosted Dr. Kotler, and he did talk about segmentation, targeting, positioning, customization, and how a specific messaging will be in a position to touch the nerve and the chord of people.
Rightly. Rightly said, Dr. Manoj. And thank you, Vijendran sir, for being there with us today.
Oh, hello,
Vijendran,
sir.
we welcome you. Well, the team from DocPlexus also seems to be here, Dr. Manoj, and I see a lot of questions from them. So let me ask one. Mr. Vikas Patnaik is asking, sir, what according to you is the role of doctor-specific social media platforms like DocPlexus, Plexus MD, and marketing of pharma products through those mediums?
Sure, Docplex, thank you for your question, and other platforms. I think anything which is neutral and perceived neutrally are those eight space which has got a lot of place for marketing opportunity, and I see it with all seriousness. So I'm not going into any specific media. All I'm trying to say is anything which has got a lot of credibility, is unbiased, is something which is taken to provide a lot of value addition, and any information piece or communication piece which is coming through that source is going to get appreciated. Point is unbiased, useful, provides value addition, and perceived that way. Rule number one, it is important that it is that, and rule number two, it is important that it is perceived that way by the customers. So, let's say in the field of hematology, anything coming from blood will get appreciated. Anything coming from Journal of Clinical Oncology will get appreciated. So, in current situation, especially in the digital space, all of us are trying to make an attempt to create that credibility and infrastructure. And once we are able to reach that stage where things comes from a lot of credibility, uh, there is a lot of scope and use for digital marketing in that space. I hope Talkplex team I have been able to answer you.
Right, Dr. Manoj, and another question from Abhishek from the same team. Generally, in digital scenario, ROI on digital activities can be measured only via e-commerce styles where actual purchase happens and money spent versus money earned. So this is the way ROI has been there. The question is, in content style digital formats, how to convince pharma companies about ROI measurements, as you would never know who read versus who prescribed. That is a question coming from a platform.
Okay, very interesting question. I think I did touch about it in my IDA model, which I tried. Uh, mm, we talked about desire and action and conversion into real business. And I think slowly and gradually, pharmaceutical industry is also trying to understand that how important it is to talk about awareness, how important it is to talk about value creation, how to be healthy, more towards AI model. So one, the trend is changing. People are understanding that it is not always about conversion. Uh, Even the equity creation has got a value, but like anything which was new, one have to have a lot of patience, and probably these patients will enable you to convince pharma professionals to say that equity creation is an equally important exercise, and eventually it leads into bigger market creations and conversions. I hope I have been able to answer you. So stay put.
One question is, Dr. Manoj, compliments for your talk. What is the future of medical representatives and pharmaceutical organizations? Whether a number of medical representatives are going to reduce or grow, your viewpoint.
So, answering it very simply is, can you replace human beings? If human beings can be replaced, there would be a place for medical representative. All of us start our medical rep. I still feel I'm a medical rep. So, will there will be a continuity of medical representative as profession? Answer to that was said by doctors in my research that they do find them useful. Will they like to continue meeting them? Of course, they would like to continue meeting them. So human beings and that bonding would continue. But yes, their expectations are changing. That means we will have to adapt our skills with the changing time. That means we will have to have things which they want to know. As I very subtly said, that they are interested in knowing commercial informations more than just science. They are interested in knowing things which is a value offering to their patients. They are interested in having a good mix of digital and physical. So this would continue, but probably we need to upgrade and adapt our skill sets, is my submission to you.
Thank you, Dr. Manoj. The next question, do you think role of pharma as medical education provider or CME will vanish? As you said, doctors have their own unbiased resources for knowledge upgradation.
Yes. Will it vanish? I have my doubts. Will it reduce? Maybe. Do we need to get into a different kind of a marketing strategy in future? Probably yes. Like Docplexes and others were trying to tell us that how important it is to have an unbiased portal. Probably people will be less interested in only listening from one or two specific pharmaceutical company until unless they are innovator in their own space. But will they be interested in listening into complete therapy management? Probably that could be one area where things could be useful. So I think this is a time when all of us really need to reflect that what is that which is relevant for our customer, for our doctors community, or for our healthcare professionals. But what would also change is the need for webinar education is there for our doctors, but we have hardly realized that the same need is also for that lady nursing staff who is giving infusion, that pharmacy staff who is right now doing integrated account management, which typical Indian pharmaceutical industry have not done so much. So probably role will shift apart from providing those value additions to doctors community to doing integrated account management where we are able to give a holistic value services to the entire ecosystem.
Right. The next question, great pointers, Dr. Manoj. By any chance, your research is available in public domain to read? I'm sure it would be highly insightful. What is your suggestion for a pharmaceutical company which is just considering digitalization?
Yeah, so any research goes to UGC and Shodh Ganga and to the government until otherwise you don't get your PhD. So that has gone, and I'm sure it will be available in public domain. But yes, I have published around 7-8 publications, and they are there in the public domain. So feel free to Google, and you would get those insights. I think he had a second point which is more relevant to him. The last part was what, Dr. Swati? What is?
Yeah. What is your suggestion for a pharmaceutical organization going into digitalization? Just now considering going.
Okay. So my first suggestion for anybody starting up is do not reinvent the wheel and do not try to become an expert of everything, which you can't. If today I want to become an expert into Google Analytics or search engine optimization or creating a web page, it will take me few months to do that. But if I hire a right professional to do the same thing, it will be easy. So what is important is create those set of people in your organization or outside as an agency who provides you these services, and you need to pick and choose. But what is very important is do the why. Why am I doing it? What is the reason for me to do this? What do I need to do this? How do I need to do this? Once your why, how, what is much more clear internally, it will be much easy for you to think, do I need to hire a resource? Or do I need to go to an agency? Or do I need to have a short term contract or a long term contract with somebody who is there? So start slow, stay invested, take small incremental steps, and things will be easy for you.
Thank you, Doctor. This answer many would be looking at, because now it is the right time to go into digitalization. The next question I'll take up from LinkedIn. Mr. Abhishek, I agree, from Abbott. He has asked, what are your views about how a webinar should be organized in these times? What should be included for the value add?
Abhishek, answering your question, I personally feel that content is very important. So understanding what is the need is more important than what is your molecule. And if you understand, and most of the time, the pharmaceutical industry is so engrossed in only talking about their molecule or therapy that they really forget to understand. Maybe the doctor's need at this point of time is to provide diagnostics, to understand diagnostics, to understand those niche things which is being left behind. So understanding what is the real need in the whole gamut of patient disease management is more important. That where does your molecule fit in? I'm yet to find a doctor who do not understand what does a pharma want when he is interacting with me. I repeat, I'm yet to find a doctor who is so intelligent than us, who do not understand what does a pharma want when he is providing a value-added service. He knows it. That if this boy, like if Abhishek is doing this work for me on behalf of Abbott, what is Abhishek and Abbott's expectation? But then if I just push what is my content, probably those value additions are not very good.
Thank you, Dr. Manoj, and hoping the question was answered. Mr. Abhishek, thank you for asking. There are many questions, Dr. Manoj, and I would club them to a single theme. The single theme is, there are many doctors who are still not very receptive about digital interactions. They do not want WhatsApp messages. They do not want mailers. They are not even looking at their mobiles. So how to motivate such doctors towards using digital, especially with GPs and CPs? He is unaware, he is less technical. What should be done?
If they don't want, don't give. It is as simple as that. Do what they want. But I'm yet to find a person. Just to give you insight, 2020, the total use was close to 75 crore CR. And by 2025, India itself will have close to 100 crore of friendly, those web-enabled mobiles. So that means this number is rising. These days, even the lowest of the pyramids are using, those mobiles. So start subtly. Don't push. Don't be very, very pushy. Those who don't want to change at all, no way we should try to change their behavior. But I'll be surprised if that number is extremely high. People are talking about digital de-addiction today a lot. There is a new fad that how long you can continue without touching your mobile. And if that goes beyond 2 hours, you are a winner. So these are the new games which is happening. So don't change subtly, and this number will reduce and the new adaptation will increase.
Thank you. Thank you, Dr. Manoj. I'll take your permission first to continue with the questions. Thank you so much. Let me read out a comment from Mr. Raman Khepar. He's saying we cannot ignore building a digital capabilities of medical representatives as they play a crucial role. We need to leverage their relations with doctors to build trust with doctors. They should be a part of the whole journey. Thank you, Mr. Raman, for your comment. Next question, Dr. Manoj, from Mayank Sharma. Sir, do you think now the concept of pharmaceutical market is changing from product marketing to service marketing? If yes, then how a company and the management should align themselves pertaining to their internal customers? I repeat, internal customers, to get the better output at marketplace.
Okay, Mayank always asks a very tough question. I guess he's from Intas, right? He's based out of really very intelligent guy. Okay, so Mayank, answering your question, eventually it is the product which a doctor is going to use if you are selling a product. But yes, you need to have that service orientation to create those concepts of going beyond the pill service. Many times what happens is we tend to focus on this is the product and this is what you should write. But if there is a lot of value addition on how to infuse the product, what kind of precondition is required, at what level the infusion needs to be monitored, what could be the safety profile, how do you balance how do you provide a balanced approach to the patient, what kind of things you must be aware of. These are some of the value additions, or these are those connecting the dots which is still required when you're giving those value offerings. I think services which you mentioned should move around the therapy area that you are that you're exposed to, and try covering those domains where a doctor is being a part of it. Many a times it is those nurses, it is that pharmacist where you have provided those value offerings become an indirect ambassador of what you intended to do during those 5 minutes, because they are going to be there with your prescriber for a longer period of time. So what kind of beyond the pill services that you give is something which is going to get appreciated. And they are, don't forget, they are your tangible people. They are your extended marketeers who are going to be with their prescriber. So connect the dots, give those value offerings which you feel is missing in around that therapy area, and do a complete integrated account management.
Thank you, Dr. Manoj, for answering the question. I hope it is clear. The next question is from Mr. Mohit Kasera. Sir, everyone talked about what is going to change in the future. Can you please explain us what is not going to change and what we can do to improve those things?
So I did touch that, Mohit. Mohit is from Goa Institute of Management, and I know him well, a very intelligent boy. So Mohit, answering your question, I did mention that email marketing is going to continue, mobile marketing is going to continue, relationship is going to continue, expectations of our customers is going to continue. So there are a lot of things which I did mention. Those 2 slides. This is something which we need to stop. This is something which we need to continue. and this is something which we need to start. So please have a look into those two slides. Uh, I think these are something in terms of decision making. I said you need to have a proper budget allocation. But I also did mention that there needs to be a lot of investment on relationship building, trust building, corporate image creation. That is something which we need to continue.
Thank you, Dr. Manoj. And in case anyone wants to go through the whole recording of the session, it will be available at LinkedIn, YouTube, and Facebook channels of Pharmaceutical Academy. You can go and revise the concepts there. The next question, Dr. Manoj, has been asked by Mr. Ganesh. So, what is your opinion on virtual MR? Which things to be considered if any organization is planning virtual interaction for marketing?
So I did tell you that where do you see a role of virtual MR? Virtual MR is a kind of a digital enabled center of excellence which beams some set of pre-decided information or communication or content or engagement to people who are averse to a live physical meeting, day-to-day meeting. Now, this is already happening with us directly or indirectly. Now, there are a couple of places where it is a possibility. For example, it's a remote place, but he is something which is providing value addition in the segments where you are present. Resource wise, it is not possible for you to connect. The third area is somebody who is averse, who doesn't want to do it. No way you can do it. So the category is very clear: either resource challenge or a personal non-interest to meet pharma are the segment which probably would be a virtual targeted customer. Obvious it is that you would reach out content at a frequency which is acceptable to him. Otherwise, it will become toxic for him. So many a times, there are various interactive portals where, you really engage with a customer and ask for information that, are you interested in receiving these information? And he clicks. And many times you go one step further and you ask, are you interested at what frequency? And sometimes he would, mention his digital behavior. Once you understand this, customizing the content, these days things are so advanced that you would understand that which is the portion he clicked, which is the portion which web page he was there for how long, where he sought an action, how that action got converted into a prescription. So by using Google Analytics, you could also be in a position to understand his complete digital behavior, and you can customize it. If you are doing shopping on Amazon, if you're doing shopping on or if you're using any of the web page aggregator services, you will understand what I'm referring to. I hope I've answered you.
Right. And another very interesting question is there from Mr. Prashant Sahu. Will there be pharma companies clubbing in future to manage best ROI from same executive?
Whether you like it or not, at some stage things are already happening. I'll give you some examples. Let's say, you have a particular institute or you have a particular account, and this account has got certain needs. So that need could be a need for, let's say, a diagnostic tool, the need for a surgical equipment, the need for few medicine, the need for some uniform, the need for infrastructure. So there are set of health related need. And this professional or this group of professionals are comfortable with few set of people because of relationship, because of trust factor. So don't be surprised if subsequently It is these set of people who have excellent relationship with this hospital or doctors who would be hired for their services in future for those specific things. I see no conflict of interest. Why four healthcare service provider cannot hire the service of one individual? I'll give you an example. Uh, let's say you have a hospital, say X hospital, and that X hospital has got 10 doctors and 12 nursing staff and 3 pharmacists and an infrastructure, and they have got these products they need. Currently, it is being visited by close to 300 sales and marketing professionals from 300 different companies. But there, you have a set of front line, second line, third line, fourth line. But these set of 10 people are comfortable with around 30 guys. And the industry clubs it together and says, okay, fine, this gentleman will lobby for diagnostics, surgical, and two medicine, which is non-conflicting. Eventually, it is about communication. Eventually, it is about marketing. Eventually, it is about collaboration. For high-end segment, I'm not about healthcare industry. I'm talking about, real estate. I'm talking about, altogether different industry, IT-enabled corporations. Those lobbying or one service being provided by 5-6 services being provided by one is already happening. So you never know where will be the future. What is important and pertinent is wherever you are, it is important to build that relationship that you are counted.
So my question is that for brands which are a premium category brands which are high value, how can we emerge as a thought leader and increase the number of prescriptions in a country like ours when we have people looking out for a value brand, something of a lesser value product? So how can premium brands work towards that, especially using the digital and the physical connect? Because there are very small pockets where the premium brands can work like magic, but all over country, if we have to increase the reach of premium brands and consumption, how can we? Thank you.
Okay, so I think I did mention that fundamental of marketing is still same. It has not changed. That means typically getting into STP, typically getting into what will work where, who has how much of potential. So I'm sure you would do those basic insights generation for your brand or for your segment very, very clearly. Only thing which would change is uh, how to expect from whom to expect. Once you have this up and ready, you would decide your own, brand vision. That what is that which is expected from country like India, and then when I'm sure you would get into your own tactical, key action steps. Action step one, action step two, action step two. Probably digital could be, one of the area. You would also have to understand that in which stage of your life cycle curve your product falls, which stage of your BCG matrix your product falls. I mean, whether there is an opportunity in that particular molecule or whether there is potential in that particular molecule, and if there is a potential, whether there is a willingness, potential and propensity. So you would do those P2 matrix and you would understand that whether there's a potential into your product or whether there's a propensity and there is a willingness to pay. And if there is a willingness to pay, whether it is an out of pocket expense which you're comfortable, which the patients or doctors are comfortable, or is it something which should come under it, reimbursement category. So once you do those matrix analysis, once you understand which stage of your innovation curve you require, whether this requires a lot of concept creation, whether this requires a lot of need creation is something which you really need to do. A portion of it only would be digitalization. I hope I have answered you.
Yes, sir. Thanks a lot.
Dr. Manoj, this is Saurabh. Hope I am audible. Right. So as we discussed that customers' expectations from the reps are also changing. Now, this question is from the perspective of L&D, learning and development, that as the marketeers are evolving and in order trying to excel in the digital initiative, how the L&D can contribute in this in terms of enabling the reps to embrace and engage the customers effectively. What would be your recommendations on that?
Okay. I think I did mention that L&D has got a very important role to play. But my first challenge anytime whenever any new concept gets come in, especially for L&D team, that they start feeling that they need to be the expert. The moment this mindset would change, things would be easy. It is absolutely okay to accept that I cannot be a digital champion. This is not my core strength. I can be a champion on effective soft skills. But am I open to accept that I need to create that infrastructure or that ecosystem where the best of the guys would come and create that facilitation? If that is something which is there, a lot of things would start changing. Problem happens when I am not an expert and I try to start giving advice. So creating that infrastructure and ecosystem and hiring the best of the talent or taking the services of best of the talent is something which probably I feel is the beginning of L&D job. And over a period of time, you and your team really need to understand what is something which needs to be done internally and what is something which needs to be siphoned off externally, and become an amalgamation of both. I hope I have been able to answer you.
Thank you so much. Thanks. Quite useful. Thank you.
Sir, Minmay here. Sir, I need a suggestion from you. In the era of these digitalizations, normally we focus on those brands which is the high value or the products or the brands who having the high signs. But for the brand metrics for our salespersons, how we can go for these brand metrics things in the era of digitalization, sir?
So, what to focus again is what is something which is really needed. It is. So let me give you an example. Since you are from oncology field, there could be a much wider thing which could be an effect. For example, let's say you have a radiation oncologist and whose interest is how do I prevent that side effect of which is caused due to radiation. For example, you have a patient who is having severe mucositis and is not able to eat anything. His whole body is charged for 5 to 6 days. Now, finding out that what is something which is of interest to him will help you to do the product positioning. A customer doesn't understand high value or low value. A customer only understand, or a doctor only understand what is needed for me and for my patient.
True, sir. Got it.
So most of the time, things which sells the maximum or which is needed the maximum may have a very small margin for you. But if you continue to sell that and build your business around that, you will have more products which is written. I hope I have been able to answer you, Manoj.
Yeah, thank you, sir. Got it, sir. Got your points.
Sure.
Dr. Manoj, I think we shall be closing now. It's close to 1. First of all, thank you for taking us through the journey, patiently answering all the questions. And I hope all the participants also enjoyed interacting with Dr. Manoj. Really sorry if we cannot take a question this time. We will try to arrange another, provided we get the permission. So permission is very, very important in the digital era. That is what we have seen. That is what we shall do with doctors also. While we communicate, we shall be asking the permission first, right? And a very, very big thank you to Vijendran sir, who joined us, Vivek sir, Sunil Attawar sir, and Salil sir also, and all the dignitaries who joined us today to hear this talk. Dr. Manoj, you have been speaking a lot for the last 2 hours, but still I'll ask for the final, before we close, please, a few words from your side.
First of all, it is an honor for me that so many of my seniors have been hearing. It is what you guys mentored me. I'm here because of them. So my big thank you. I also wanted to say that I have my first boss also hearing me today, Mr. Sandeep Verma. So Salil, Mr. Sandeep Verma, they were there in the beginning of our career. Vijendran sir and so many, Vivek sir. Really, really grateful to you. I mean, it is those those external mentors who have made us whatever we are today. Uh, the uh, the final comment would be very simple. Know that this is inevitable. So embrace it, accept it, adapt it, acquire it. At the same time, also understand that you don't really need to change every possible thing. Say what is going to work in your area, and then eventually move. There was a couple of revolution which was there: industrial, river valley civilization. Digital revolution is there. We need to embrace it and move it for our betterment.
Thank you so much, Dr. Manoj. This is inevitable and we are embracing it. Industry is going through it. Learning and development is going through it. So a lot of sessions you will see from our side also happening. This is all from our side. Thank you all the participants for joining and listening to Dr. Manoj today. Your questions are most welcome. And as we discussed, we will try to bring along one more session with Dr. Manoj. That is all from our side. Have a wonderful Sunday ahead. Thank you, Dr. Manoj. Thank you all.